care system. I am honored to be with you here today, and I'll take a moment to introduce the folks who will be following me to speak. One, Ms. Kathy Bailey, our President and CEO of Blue Ridge Healthcare. Also, Mr. Steve Burris, who's the Chief Operating Officer of UNC Health. I'd like to thank our UNC Health colleagues for making the trip here in person. I know it means a lot to our team and to the community to welcome you to Blue Ridge on this special day. Today's announcement reflects the direction that has been identified by the Healthcare System Board of Directors and the many contributions of our leadership team, ably led by Ms. Bailey. And let's not forget our exceptional team of healthcare providers who right now are caring for patients and who have worked so hard over the last 18 months during the pandemic to care for our community. We owe them a great debt of gratitude. I would also be remiss if I didn't say that to put Blue Ridge Healthcare System in a position to take advantage of this opportunity with UNC is not just what we're doing today, but it's what we've been doing over many, many years to position ourselves. And I've got to thank all the healthcare providers, all the teammates, all the board members who have worked so diligently over many, many years to make this happen. This is truly a pivotal moment in the history of Blue Ridge Healthcare, one that will ultimately shape the future of healthcare delivery in our region for generations to come. On behalf of the entire Blue Ridge Board of Directors, we are pleased to announce that today we have finalized our agreement for Blue Ridge to become part of the UNC Health family through a comprehensive management services agreement. Both of our organizations share a commitment to rural health care and will focus together on delivering an even higher level of care for those that we serve. Joining the UNC Health will allow Blue Ridge to increase specialty services and grow access to an expanded network of care right here in our region. UNC Health understands the importance of partnering with strong community hospitals like ours to keep care local by expanding access to healthcare providers and services. This thoughtful and carefully considered decision by the Blue Ridge Board of Directors reflects a commitment to keep our local communities and patients at the center by enhancing, growing, and securing access to superior health care right here at home. Now I'd like to invite Mr. Steve Burris to say a few words.
Thank you, Mr. Bridges. Appreciate your comments. Good morning. I'm Steve Burris, Chief Operating Officer for UNC Health. And on behalf of the Board of Directors, our CEO, Wesley Burks, and nearly 40,000 teammates from across the state of North Carolina, I'd like to welcome Blue Ridge to the UNC family. This is truly a momentous day. Our mission at UNC Health is to improve the health and well-being of North Carolinians and those others whom we serve. And today is the official beginning of our relationship to do just that. We take our mission seriously. Working together, Blue Ridge and UNC will manage access to high-quality medical services for citizens of this region while leveraging the resources of a large health system. This agreement underscores both organizations' commitment to rural health care and will help Blue Ridge deliver an even higher level of care throughout the region. Likewise, having Blue Ridge as part of the UNC family enhances UNC's ability to provide high-quality care, but locally. That's really important to our mission, is to make sure that care is accessible and local. Working together, we will form a high-performing network of facilities and clinicians focused on elevating the health and well-being of those we serve and keeping care local. Today is just the beginning, a starting point for our relationship. I thank you all so much for the hospitality you've shown us through the last many months of working together, and welcome you officially to the UNC Health family. And now I'll turn it over to your president and CEO, Kathy Bailey.
Thank you, Steve, and thanks to all of you for joining us on this momentous day. I have been president and CEO of Blue Ridge Healthcare for almost 9 years, and I have never been prouder of this team than I am today. Our team, who right now are hard at work inside the buildings around me, have truly served on the front lines over the last 18 months fighting this terrible virus. They have fought hard and with great compassion, and they have never given up, even during the most difficult days. So I want to honor them, to acknowledge all they have done for this community, and to truly thank them on behalf of our patients, our friends, and our neighbors. They truly embody what it means to be a healthcare hero. When I became CEO of Blue Ridge in 2013, I pledged to lead this system with a focus on maintaining the proud legacy of our past, while at the same time leading us into the future. Today is perhaps the greatest milestone in our history. It's one that will enable this great team and system to provide the best possible health care to our community and to our loved ones for many, many years into the future. Today is the day we become an official member of the UNC Health family. Both UNC and Blue Ridge share a unique commitment to rural health care. We are jointly committed to growing and enhancing access to high-quality health care close to home for those we serve today and for generations to come. Therefore, it is my distinct pleasure to announce that as of today, we are now UNC Health Blue Ridge. You will begin to see our brand unveiled throughout the system over the coming months. This new co-branded logo and name is the first tangible example of our partnership with UNC Health. Through this, we will become a better and stronger healthcare partner to the communities that we serve. So there's still more work to do to fully transition to UNC Health, but today marks a monumental and exciting milestone for us. Thank you all for joining us this morning in celebration as we become UNC Health Blue Ridge. Thank you.